Sinus precautions. There are two common scenarios where patients are asked to follow these instructions. The first and most common situation involves the removal of upper back teeth. The roots of your upper teeth have grown through the bone and into your sinus. Following their removal, an opening into the sinus was visible. The second involves patients undergoing a sinus lift, graft procedure, to allow for the placement of dental implants. The general post-operative instructions still apply, but we would like to emphasize a few important points about your particular procedure and remind you of some instructions. By adhering to the following sinus instructions, you may ensure that your recovery is uneventful and comfortable. Avoid blowing your nose for at least 7 days. Although some discharge, perhaps containing blood for the first few days, may be expected.
If you must sneeze, do so with your mouth open to avoid any unnecessary pressure on the sinus area.
Do not smoke or use smokeless tobacco for 2 weeks.
Smoking greatly inhibits healing, especially in the sinus graft.
Do not use a straw for 2 weeks. Do not lift or pull up your lip to look at stitches, as this may create damage and tear the stitches. Refrain from any vigorous mouth rinsing. Please take prescribed antibiotics as directed and until finished. They are essential to prevent infection. If you feel congested, you may need to use antihistamines or nasal decongestants, such as over-the-counter tablets or sprays. Most of the time, patients do fine without any nasal sprays, antihistamines, or decongestants. Strict adherence to these instructions may prevent the necessity of another surgical procedure at a later date. If you have any problems or questions, please call our office at 604-504-7522. After normal working hours, our answering service will page the doctor on call.